Okay, so we're going to talk about CAUTI, or catheter-associated urinary tract infection, which is considered a condition that is given to you by bad health care and it doesn't get paid for, plus it can kill your patient. So it's rather important that Foley catheters are inserted only when needed and correctly. And there is in Meditech, you will find a check sheet of sorts that you can put in there the reason why you're putting in a urinary catheter, because no longer is because the doctor said so a good enough reason for putting a catheter in. It needs to be, if you can see on the top of our catheter trays, is the reasons listed here, which is a patient has an acute urinary retention or bladder outlet obstruction, need accurate output measurement for acutely ill patients. You're in certain surgical procedures to assist in healing of sacral or peritoneal wounds. Patient requires prolonged immobilization or to improve comfort for end-of-life care. And there may be one or two other ones, but that needs to be limited to those reasons. Now, putting a catheter in correctly cannot be overstated, because incorrect insertion, incorrect cleaning, incorrect technique all lead to increased, sometimes exponentially increased risks of urinary tract infections, which, especially in the elderly population, can lead directly to sepsis and then death. So, we have a patient here that we're going to call patient, and we have to put a catheter in. We've already verified that that is what the physician wanted. We've discussed it with the patient. Now we need to get ready to put the catheter in. You can put them in with one person. If you have two, that's even better, especially if it's an individual that is has comorbidities, is obese, is incontinent, is elderly. So the first thing we're going to do is we're going to put on gloves. So we're going to go find our gloves here. So give me a second to run over here and get our gloves. And we're going to do hair and hygiene. And I don't think, well, besides line placement, there's no other time that hand washing could be nearly as important as when you're putting in a Foley. So wash your hands, put on gloves. Then you're going to disrobe the patient. I usually try to give them a sheet to put over their thighs or their abdomen so that we can keep them as covered as possible. But it's important that they don't pull the stuff back over them, because if you clean them and or if you have to reach up to grab a cover, you're recontaminating yourself. So we're going to go ahead. This is our patient. And as you can see, we have a female patient that we're putting this in. Lighting, bed, all needs to be at an optimum angle so that you can do this correctly. If the patient has fecal material or yeast, a large person, looks like poor hygiene for whatever reason, you need to clean them up first. So you would get a washcloth or one of our bath packs and clean them up, and paying special attention to make sure that your entire area is clean. So once that is done, then we're going to open up our catheter. You need to have a surface that is adequate for the task at hand. Open it up. Now remember, this is sterile. So we've also, by the way, changed our gloves again, because once you clean up such areas, you need to take off the gloves, clean your hands, put new gloves on. Now, the kit is set up in a certain way. Take off the overwrap. Now we have this. So you've got this little kit first, and it's got some hand sanitizer gel in there, and you can wash your hands with that, and it's also got Castile soap in there. I believe that's what that is. Yep. So you're going to open up that packet right there, and you're going to open that pack up, and you're going to take up the towelettes, and I think there's 3 of them in there. You're going to use all 3. You're going to take your towelette and you're going to kind of make sure that you got the whole area clean. Throw that away. You get another towelette. You're going to clean down here to make sure you don't have any E. coli in the area. Throw that away. 3rd one down, done. So then we take off our gloves, wash our hands again, put on your gloves. We may end up starting to use these. This is a orange sticker that kind of highlights the fact that we are putting in a catheter, when it was started, and all that stuff. Because we need to do surveillance of catheter insertions to be able to determine what our rates of infection are, these are going to end up right now on a card filled out and then put under Jen's door. Or you can give them to me. Now, it kind of tells you right what to do here. Orient towards the insertion site. So in this case, our insertion site is over there. But I can put a catheter in right-handed or left-handed because I learned wrong and discovered when I learned right that I can do either right-hand or left-hand, which comes in handy. You need to be on the side that is your strong side. And you're going to open up at this point you can have gloves off. And but I'm going to keep these on for a minute. Then when you open that up, that's what your kit's going to look like. And I'm not going to put the sterile gloves on, but we're going to pretend I did. So you would put on the gloves, maintaining sterility. You've got these drapes. Now, I will usually, now of course, you know, patients don't generally lay that direction, but I always put one of these kind of tucked under right like that, just in case, so we have a little bit of a sterile field there. I don't use the fenestrated drape because it gets in my way, but if you would put it over, well, you can figure that out because, you know, you put the hole where you need to be putting stuff. Then, the next thing you come to is your stat lock. More about that later. Put that to the side. You need to make sure that the patient is not allergic to iodine because you're going to be cleaning them with that. And seeing that it is winter and this just came out of a car, it's the first time I've seen solid iodine solution. So we're not opening that, but these are set in there like this. And they do get, you may have to redo that. Open it up, pour it in there so that all the tips are in the solution. Then you put that to the side. Now, it used to be they told you to check your balloon inflation. You don't do that anymore. You go ahead and hook your syringe to your catheter because when you get in there, you want to be able to insert it. Or you can wait, it all depends, because it does make it heavier to control. And then you would put your goo, there's a tray here, see, and right there is where you put the goo. And you just put the goo all along that tray bottom there, the whole syringe full of goo. And then, when you have your catheter here, remember, you're still sterile, so you make sure everything's gonna work. Take off your sheath, maintaining sterility because you don't want this catheter to flop around and hit something. So we have that off. There's your catheter. Now, it is designed so that while you're finishing up, get it to lay, it will lay just like that. So, see? It holds it there so long as you're not dangling off of something. So once that's all done, now once you touch the patient, the hand that touches the patient stays where it is. So you're going to go ahead and put your, in this case, you know what we're doing. You take one swab and you swab, throw away. Second swab, swab, toss. Third one, toss. Now, one of the big secrets of not getting a urinary tract infection is prepping correctly. So remember, you clean them up with a washcloth, especially if there's any yeast or fecal material, or if they are bad, poor hygiene. Then you move on to using the Castile soap wipes. You don't just use the Castile soap wipes and don't just throw them to the side, or you guarantee an infection. Now, having said that, now it all depends. If my patient is not kicking and they can cooperate, I will bring the entire tray in between their legs, but sometimes you can't do that. The important thing is that when you pick up the catheter, that you have it gripped and you don't let it go, because you don't want it dangling, you don't want it touching anything. So again, you would, and it's already lubricated, we hope. There we go. So then you would carefully insert, making sure that you're not dangling the catheter over, because you got to be mindful of where the rest of that catheter is. And if you over lubricate it, it's going to take a minute for you to actually see a urinary return. But in women, once you see the urine coming back, you can stop, because you don't really need to go to their tonsils with it. And then once you're there, inflate the balloon. And your patient shouldn't be yelling, ow, 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 it hurts. And you shouldn't be seeing blood come out of the catheter. That's all a problem. Or if you meet like unusual resistance, stop sooner than later. So that's in there, and catheter's in. And as you see, the balloon is right there in the back, so we're perfect position. Of course, you can't really do that with a real patient. I get that. Now, you take the catheter after you're done. Get new gloves. Wash your hands, and we're going to take this right here, because you want the catheter bag and the catheter to be, you don't want it sitting up on the bed, because you don't want the urine sitting there growing crap and then getting shoved back up into the bladder. So it needs to be draining, which means gravity. Make sure you put, wherever you're putting this bag is hung up on a area that isn't going to get ripped out, and don't lay it on the floor. So it can't be on the floor, you don't lay it on the bed, and you need to have it hung nicely on the side of the bed. And then another important part of all this is the stat lock. So that's important because moving the catheter up and down obviously everything outside of the bladder and down the urethra, everything past that is a source of infection. So it grows stuff, and if you shove it back up in there by moving the catheter, and you also don't want it to become dislodged and the bladder and the balloon get yanked out, because that can cause damage too, and blood clots. There is a skin prep here to keep the adhesive from doing anything bad. You put that on either leg, and then you go ahead, these fit in there like that. That snaps over, kind of like that, just like that. And then this goes on their leg. Now, when it comes time to take off, please put alcohol on there to take it off. Don't rip it off their leg, because they're going to be missing some skin and thinking about you for a while. Now, there you go. To maintain the catheter, make sure every day, every 24 hours, you need to verify the fact that it is still needed. If it's not, talk to the doctor, remove it. If it's still needed, okay. Also, you need to do very good pericare in the morning. So, when you're doing their AM and PM wash-ups, make sure you're washing around the catheter and you're keeping things clean down there. I don't think I need to go into that anymore. You make sure that this is running downhill. Urinary, if you're drawing urine, you can draw it from the bag if you're just put the catheter in right this second. Once you hang it on there, you need now, 3.5 nanoseconds maybe. But the point is, if you don't draw it out of the bag when you first put it in, like right then, 30 minutes later, when you come back, you need to draw it from this port right here. So 10 cc syringe, hook it on there after you scrub down the hub with either a chlorhexidine wipe or an alcohol wipe, but you need to use friction and scrub it well. Then put that on there. Sometimes you don't have enough urine sitting in the tube to get your urinary. Now sometimes they have enough output, it doesn't matter. Should you need to do that, there's a urine, you can use a catheter clamp or some other device that temporarily holds the tubing like that, just so you can get enough. Don't walk away and remember it 6 hours later, because it's backing up into the bladder, and urine is a great medium for bacterial growth. So, having done all those steps does not guarantee no urinary tract infection, but it does minimize the risks. Okay, a quick word about male catheterization. Pretty much we've reset back to the trays laid out, we're getting ready to clean. Again, especially if they are not circumcised, you need to pull back the foreskin and clean that with just like you were given a bath with a washcloth or with the bath packs. And you want to keep that foreskin retracted for the procedure. Now, again, make sure they're not allergic to iodine, then clean up once, twice, 3 times. Now, of course, back to the cleaning up part. You would also, after you clean them up, especially if they, you know what I'm talking about, not circumcised, haven't done a lot of personal hygiene for whatever reason, elderly, obese, doesn't feel like it, you need to do that first, then the Castile soap, also foreskin retracted, clean with the Castile wipes, before you do the iodine swabs that we did. So iodine swabs are last. Now, you again move everything over here, same setup as you do for the female catheter. Now, may not have enough, there we go. Now, for men, sometimes, especially elderly guys, you may need, or just wimpy guys, you may need a Urajet, which is lidocaine, which is KY jelly with lidocaine. It takes an order from a doc. I think we do have it in the Pyxis. So if you use the Urajet, you can either put it in there, or it has a syringe tip on it. You can put that gently in the meatus and kind of give a little bit. You don't want to put the whole 60 cc's or 30 cc's that way, but a little bit. Plus, you want to make sure that you're well lubricated. Also, sometimes, especially with elderly guys and prostates, you may have to use a CAUTI catheter and change out catheters. Now, it's always helpful to know if they do have prostate hypertrophy, because it's always better to do this one time. There's no different criteria for men than women. So once you do this and you pick up your catheter, again, you don't want to touch you don't want to touch the bed. Now, with men especially, and this is easier when you actually have a whole person and not just a part, but you may have to do a little bit gentle traction by holding your, you get the point. You don't want to squeeze the life out of the sucker. You just want to have gentle traction, which helps get your urethra straight through your prostate. Then you're going to go put that in there. Now with men especially, you need to go all the way to the bifurcation. So you have them breathe deep, lubricated well. Sometimes you got to pull up and hold pretty good traction. Now I've seen some urologists pull patients up off the bed via their manliness, but I don't suggest you try that. And if you meet resistance, just stop, pause, have them take some deep breaths, and try to relax and try to go through there. Now, once you get to the bifurcation, pretty sure we're okay in this dude, but some guys you do have to go all the way to the bifurcation, which this little guy, it may be a little difficult, because generally speaking, it's just, now sometimes you do have to go little by little. Take deep breaths, relax. It's okay, Mr. Dude. It'll be over shortly. So, up to the bifurcation. Then you keep your hand here while you're putting the fluid in. Purpose is so that you can feel if a balloon is blowing up in the penis, because you don't want that. You tell your patient beforehand it should not hurt. If they start yelling, whoa, 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 stop. and you will hopefully see urine. Occasionally you don't, 'cause like I said, especially if you use the Urijet and you put a lot of lubricant down in the urethra before you put the catheter in, it's going to end up taking a little bit for the urine to start flowing through that gel. Now, once that's in there, no yelling, you're feeling right in here where you'll feel the balloon start to blow up. That's all going well, that's great. Wash your hands. Then you're going to pull this back. Actually, you're going to do that before you put everything away and wash your hands. But you're going to pull this back until it's nicely snug. You don't yank it. You just want the excess to come back. And there you go for the backside view. And this patient has had a very bad trauma, so he's been sutured up. Hence, we're okay with catheter. So he's been stapled up. Now, for men, it doesn't matter. You're still going to use a stat lock. Sometimes they have a preference, sometimes they don't. You want the catheter, again, not to be all bunched up, not to be sitting anywhere where it can collect drainage. So put to the side of the bed. Same principle as with the female. Urine send to the lab, same. So stat lock, put it on, and you make sure that you give them enough. You want enough give in the thing, so if they put their legs straight, they don't yank their catheter out. And they need to be able to move around and walk without, feeling like they're going to lose their manlyhood. After that's done, make sure, especially if they aren't circumcised, that you retract the skin back over the head of the penis, because if you don't, they're not going to like it, and you're going to go, oh my, next time you assess the patient, or anybody assesses the patient, because it will swell. And getting the skin back over the glands once it's swollen is a little bit tricky sometimes. And again, catheter care daily, and when criteria has been met, pull it out. And that is it.